Welcome to The Explainer. Today we're going to break down the creatinine test. You know, it's a super common blood test, but it's basically a window, a vital peek into the health of some of your most important organs. So, let's start with the question. How do your kidneys actually tell you they're working? I mean, they're not going to send you a text, right? Well, it turns out the creatinine test is one of the main ways your doctor gets to, listen in on that conversation. All right, so to really get a handle on this, here's our game plan. We'll look at what your kidneys do, what creatinine even is, why you'd get the test, what your results mean, and finally, why it's about way more than just one number.
Okay, first up, let's talk about the incredible organs at the heart of all this, your kidneys. And you'll see pretty quickly that their job is a whole lot more than just filtering stuff out.
I mean, seriously, think of them as your body's own personal water purification plant, and it's running 24/7. They're these unsung heroes, just constantly, meticulously cleaning your blood to make sure your whole system stays balanced and running just right.
So if your kidneys are this amazing filtration system, how in the world do we check up on them? How do we know they're doing their job? Well, we look for a very specific clue in your blood. And that clue? It's a little substance called creatinine.
Now, the most important word here is normal. Creatinine isn't some bad guy or a foreign invader. Nope, it's a totally natural waste product. Your body makes it every single day, just by you while moving around and using your muscles.
And this shows you the whole journey. And it's actually pretty simple. 1, you use your muscles. 2, a little bit of that muscle tissue breaks down. 3, creatinine gets created and pops into your bloodstream. And 4, your healthy kidneys jump in, filter it out, and send it on its way through your urine. It's a really elegant, efficient system when it's all working.
Okay, so you're probably thinking, if this is all so normal, why in the world do we even measure it? Good question. And this is where the detective work really starts. This is where your creatinine level becomes a critical piece of evidence about your health. Well, there are a few big reasons your doctor might order this test. It could be just part of a routine health checkup, or maybe they're trying to figure out what's causing some symptoms you're having. It's also used to monitor a known kidney problem, to see if a treatment is working. And sometimes it's just to make sure a new medication isn't causing any trouble for your kidneys. And yeah, speaking of symptoms, if you're dealing with stuff like swelling in your hands or feet, or you're just tired all the time for no reason, or you notice changes in how often you go to the bathroom, your doctor might order this test to see if your kidneys could be behind it all. But, and this is so important, you don't have to feel sick to have a problem. A lot of the time, early-stage kidney disease is totally silent. That's why if you have certain risk factors like diabetes or high blood pressure, your doctor might want to check your levels on the regular just to keep an eye on things.
All right, now for the part everybody wants to know about. Let's decode those numbers on your lab report. What do they actually mean?
So your result can come back either high or low. And this gives you a quick breakdown of what each one might mean. Now, high levels could be a sign of kidney issues, for sure. But it could also be something as simple as you're dehydrated or you ate a lot of meat recently. On the flip side, low levels, which are way less common, might point to things like malnutrition or losing muscle mass as you get older. Okay, listen up, because this is probably one of the most important things to remember. Getting a normal result feels great, right? But it is not a guaranteed all clear. Why? Because in the early stages of kidney disease, your creatinine levels can actually look perfectly fine, even when some damage is starting to happen behind the scenes. And that right there brings us to the biggest takeaway of this whole explainer. A single number almost never tells the whole story. Your doctor has to look at the big picture.
I mean, think about it. Your age, how much muscle you have, even what you ate for lunch, all of that can nudge your creatinine level up or down. And that's exactly why doctors see this number as just a starting point. It's the first clue they use to plug into some much more powerful calculations.
And here are the big ones, the key calculations that give a much, much clearer picture of what's going on. They take your creatinine result and use it to estimate something called your eGFR. That's a way better measure of how well your kidneys are filtering. They might also look at creatinine clearance that compares what's in your blood versus your urine, or a test called UACR, which is amazing because it can spot the absolute earliest signs of kidney damage by looking for tiny bits of protein.
So, please remember this. The whole point of the creatinine test isn't to slap you with a scary final diagnosis. Not at all. Its job is to give your doctor some really important clues, just one piece of the giant puzzle that is your overall health. And at the end of the day, all this knowledge, it really is power. It changes everything.
You go from being someone who just passively gets a test result to being an active partner in your own healthcare. When you understand the what and the why, you can ask way better questions and you can have a much more meaningful talk with your doctor. So the only real question left is, what are you going to ask?